This is the SCIPE procedures for the punctate mechanical stimulation. So we want to make sure that we read the instructions fully to the subject, make sure that they understand what we're going to be doing. We will want to provide them with the visual of the sensory pleasantness and the pain intensity rating scales, because after we present each of the stimuli, we are going to ask them to give us a rating on these two scales so they can see that it's 0 to 100. They can see what the anchors are for these scales. 0 is not unpleasant at all, and 100 is the most unpleasant imaginable. And they can give any number between 0 and 100. It doesn't just have to be the numbers that are present here. And then for pain intensity, it goes from 0 to 100, of course. 0 is no pain, and 100 is the most intense pain imaginable. We want to let them know, again, they can give any number, and then if someone responds with a 5, let's say, something between 0 and 10, if someone responds with the number 5, we want to make sure that they are using the 0 to 100 scale. So just remind them that it's a 0 to 100 scale, and whether or not they mean a 5 on that scale, or if they accidentally were going back to the more common scale of 0 to 10. So if they say a 5 on 0 to 10, they might want to say a 50 on the 0 to 100 scale. So anyway, it's nice to have a visual of these two scales for them to just see in front of them, because we'll be asking these same questions over and over throughout the testing. So first you want to practice on the left cheek, and you can press the filament against the skin. You leave it on for 1 second. Make sure it's perpendicular to the skin. And then once it bends, fully bends, then you leave it on for 1 second, and then you remove it. Try to avoid repeating a trial unless the filament slips or slides. So sometimes when you go to press it against the skin, it slides off the side of the skin. Try to avoid doing that, obviously. Present the stimulus perpendicular to the skin, so it's less likely to do that. And if it does do that, then you just say, oh, I'm sorry, I need to redo that trial. And so then wait about 15 seconds and then try it again. After each trial, you're going to record the sensation. And if it was on, first you ask them if they felt the sensation, any sensation. Then you would ask them if it was if it felt the same or similar to the cheek, unless of course it is, you're testing on the cheek. And then ask them for ratings of the unpleasantness of the sensation and the pain intensity on the 0 to 100 scales. Okay, and then once they understand what's going on by giving them the practice test on the left cheek, we'll proceed from that left cheek to the right side, and then proceed down to the second, third, and fourth test sites, waiting 15 seconds between each trial. Then go back up to the cheek to do the second trial at each spot, recording all of the responses each time. Here's a couple of visuals. This is on the cheek. Okay, you can see that although the filament spun around a little bit, it didn't slip on the skin. It pressed into the skin 1 second, and then you take it off. Here it is on the leg. Very simple. 1 second, take it off. Make sure it's fully bent. Push it enough that it's bent, and then leave it on for 1 second. And then ask the participant the questions. And it usually takes about 15 seconds anyway to complete each of the questions. So you have that 15-second period between